Prism, and with doctors seeing 30 patients a day, a lot of them are spread pretty thin, so patients answer a bunch of questions, some that they might not even think are relevant. But doctors are looking at the overall quality of life rather than diagnosing a patient at the surface level and sending them out the door.
I'm scared to get back in it. It's why it's hard to even put it back together with the new parts and everything.
Jessica Rayum's ATV sits broken in her garage, collecting dust for almost a year now.
Say that you got to get over your fears and do it sometimes, so.
But after a ride with friends, her whole life changed.
I was driving and I was strapped in and the road started to give way, so it rolled over onto the right-hand side. The seats, the way that they were in there, my leg got caught.
Tearing her femoral artery, also suffering a large hematoma.
I was bleeding internally, and so your leg starts bleeding internally, and it was rapidly filling with blood. So it was a big bruise instantly that just grew larger and larger.
Pain she'd never experienced before, pain she was forced to endure.
I was seeing a local doctor for, it was about 6 months, and it was just not getting better and not getting better.
MRIs, x-rays, and misdiagnosis. Months of pain that put a halt to everyday normal activities. Playing with her niece, walking the dogs, out of the question. And when tickets came for her first Lions game, instead of excitement, frustration.
Getting up there, getting through the stands, walking around, maneuvering with crutches. And it was just so hard I didn't even want to try.
Jessica sought a second opinion, and when she did, she arrived at the doctor's office greeted with something unusual. An iPad.
It kind of seemed like it was coming out of left field.
Equipped with 125 questions on a program called Prism.
I believe that there was a question that asked about my household chores. And you don't think about that stuff and how much time you put into that.
Most of our patients come in and they want their pain fixed. They say, we just heard.
Dr. Bindu Lewis uses Prism for her patients, and it helps her gauge what's really going on before they even step foot in the office.
We can look at this data and say, the patient comes in and says, their pain hasn't changed much, right? Because it's sometimes hard to get a handle on chronic pain. It takes time. But the Prism data will show that they're doing better in their personal life. They're less depressed. They're more functional.
And answering the questions ahead of time saved Jessica a lot of time and frustration.
She didn't have to spend lots of time going over questionnaire after questionnaire after questionnaire when I'm sitting there right there with her, and it was more personable.
Now Jessica says her depression is fading and is getting ready for a spinal simulator implant that will help ease the pain in her nerves in her leg.
I was in training for my first 5K, so I'm desperate to get back into training for that.
And she says maybe even getting back into the driver's seat.
I'm thinking about starting with a golf cart and going from there, just little bits, nice and easy.
So all the answers to the questions go into a database, and the doctor can track it, and they'll ask them later again to answer the same questions so they can compare it. But it really is true, like say we all have the same back problem. We're all going to be affected differently. Even little things like if your bedroom's upstairs or downstairs, or if you're more active, and if you're more sensitive to how it will affect you emotionally, like depression or something like that. So it's interesting.
How frustrating to not know what the problem is and to get those misdiagnoses.
And it happens more often than you think. So.
All right. Glad she finally can make up for some lost time.
Absolutely.
Cassie, thanks.